Welcome to today's SNAP E&T History presentation, delivered to you by the CareerSource Pasco Hernando Welfare Transition SNAP Department Program Manager Cheryl Goebel. Today you'll be learning about the SNAP history. Back when the program first started, it operated by permitting people on relief to buy orange stamps equal to their normal food expenditure. For every $1 worth of orange stamps purchased, 50 cents worth of blue stamps were received. Orange stamps could be used to buy any food. Blue stamps could only be used to buy food determined by the department to be surplus. The food stamp program actually started back on May 16th of 1939. The program was implemented due to widespread unemployment and food surpluses. The first recipient to receive food stamps was Mabel McFiggin of Rochester, New York on May 16th of 1939. Then in 1961, an initiative called the Pilot Food Stamp Program was started by President John F. Kennedy. The first program, in contrast, was begun without any involvement of the executive or legislative branches, but was moved into action solely by the USDA under pre-existing statutes. The Food Stamp Act of 1964 was developed to help low-income households achieve a more nutritionally balanced diet. The goals were to help such households to receive a greater share of the nation's food abundance by redistributing agricultural surpluses to poor individuals. Coupons could be exchanged for food in any grocery stores. The major provisions were: required a state plan of operation and development of eligibility standards by states, required that participants purchase their food stamps, paying an amount with their normal expenditures for food and receiving an amount of food stamp representing an opportunity more nearly to obtain a low-cost, nutritionally adequate diet. Established eligibility for purchase with food stamps of all items intended for human consumption except alcoholic beverages and imported foods. The House version would have prohibited the purchase of soft drinks, luxury foods, and luxury frozen foods. Prohibited against discrimination on the basis of race, religion, creed, national origin, and political beliefs. It was divided responsibilities between states, certification and issuance, and the federal government, funding of benefits and authorization of retailers and wholesalers, with shared responsibility of funding costs of administration and appropriated for the first year funding limited to $75 million, $100 million for the second year, and $200 million for the third year. Program expansion between 1965 and the early 1970s. In 1965, there were approximately 500,000 people on the program, and within a 10-year period, the number grew to more than 15 million participants, primarily due to geographic expansion. The early 1970s were a period of growth in participation, concern about the cost of providing food stamps, and questions about administration, primarily timely certification. This was during the time that the issue was framed that would dominate food stamp legislation ever after. How to balance a program access with program accountability. The Food Stamp Amendment of 1970 passed in January of 1971 and established uniform national standards of eligibility and work registration requirements. During this period, the food stamp program was expanded to Guam, Puerto Rico, and the Virgin Islands of the United States. Agriculture and Consumer Protection Act of 1973 passed on August 10th of 1973 and required states to expand the program to every political jurisdiction before July 1st of 1974. This expanded the program to drug addicts and alcoholics in treatment and rehabilitation centers, established semi-annual allotment adjustments, SSI cash out, and bi-monthly issuance. It introduced statutory complexity in the income definition by including in-kind payments and providing an accompanying exception, and required the department to establish temporary eligibility standards for disasters. The legislation also added a new category of eligible purchases with SNAP benefits, seeds and plants that produce food for human consumption. During this time, the department was authorized to pay 50% of the state's program's cost by administering the program and established the requirement for efficient and effective administration by the states. Then on July 1st of 1974, the program was fully implemented nationwide, including Puerto Rico. The food stamp program continued to see changes along with changes in political administration changes. The Food and Nutrition Service Administrator played a major role in trying to rally around reform and sweeping changes. Pushing hard and fast, the reform focus was on elimination of the purchase requirements because of the barrier to participation the purchase requirement represented. The law that was approved and passed also created some of what we still see today, like the established job search requirement, penalization of households for intentionally quitting a job, and the inception of expedited services and poverty guidelines. Participation milestones were made in 1981 and the participation levels rose to a record high of approximately 22.4 million people. Then the large and expansive food stamp program came under close scrutiny of both the executive branch and Congress in the early 1980s. Major legislation in 1981 and 1982 enacted cutbacks, which included and added a gross income eligibility test in addition to the net income test for most households, introduced a temporary freeze on adjustments of shelter deduction cap and the standard deduction, and constraints on future adjustments, created a state option to require job search of applicants as well as participants, and increased disqualification periods for voluntarily quitting a job. The Food Stamp Act of 1985 required all states to implement an employment and training E&T program by April 1st of 1987. Congress defined an E&T program as containing one or more of the following components: job search training, workfare, work experience or training, or other programs as approved by the Secretary. The new legislation replaced the disqualification for refusing to comply with job search with a disqualification for refusing without good cause to participate in an E&T program. The Food Stamp Act of 1985 also required the Secretary to establish performance standards for minimum participation in the state E&T programs of persons subject to the work requirements. The new legislation replaced the disqualification for refusing to comply with job search with a disqualification for refusing without good cause to participate in an E&T program. Performance standards were also implemented, as well as federal grants for states to operate and receive up to 50% reimbursement for agency expenses. During this period, states were required to also implement reimbursements at $25 per person per month for participating in the programs. Electronic benefit transfer, also known as EBT, is an electronic system that allows a recipient to authorize transfer of their government benefits from a federal account to a retailer account to pay for products received. Benefits are delivered to clients on a debit card. The first electronic benefits transfer pilot began in Reading, Pennsylvania in 1984. The pilot was tested for several years, and it was not until 1993 that Congress strongly urged all states to develop and establish EBT systems as an alternative use. EBT helped cut back on food stamp fraud by creating an electronic record of each food stamp transaction, making it easier to identify violations. The rate of trafficking went from nearly 4% in the 1990s down to around 1% after the EBT was fully implemented. In many states, EBT was also used to deliver the Temporary Assistance to Needy Families, also known as TANF program. The federal block grant program operated by the Department of Health and Human Services and other state programs as well. In 1992, 7 states had the first approved food stamp nutrition education state plans. These states were New Hampshire, Ohio, New York, Minnesota, Wisconsin, Oklahoma, and Washington. State plans were optional and encouraged states to provide nutrition messages that focus on reinforcing the link between food security and a healthy diet through nutrition training, information, and material distribution to eligible households. The goal of FSNE is to improve the likelihood that persons eligible for food stamps will make healthy food choices within a limited budget and choose active lifestyles consistent with the current dietary guidelines for Americans and USDA's food guidance system. The mid-1990s was a period of welfare reform. Many states had waivers of the rules for the cash welfare program, aid to families with Department of Children and Families, also known as AFDC, before major welfare reform legislation was enacted in 1996. The Personal Responsibility and Work Opportunities Reconciliation Act of 1996 removed the entitlement of recipients to AFDC and replaced that with a new block grant to states called Temporary Assistance to Needy Families, also known as TANF. For example, placed time limits on food stamp recipients of 3 out of 36 months for able-bodied adults without dependents who are not working at least 20 hours a week or participating in the work program. Welfare is no longer an entitlement. Participation declined throughout the late 1990s, even more so than expected based upon the changes in TANF and falling unemployment. Program access and simplification of program rules were a major focus of proposed legislation and of major regulations by the department. In May of 2002, the Farm Security and Rural Investment Act of 2002, also known as the 2002 Farm Bill, were enacted, and major changes came to the food stamp program, which included restored eligibility for food stamps to qualified aliens who have been in the United States for at least 5 years. It also restored eligibility for immigrants receiving certain disability payments and for children regardless of how long they have been in the country. These changes caused steady increases, and by the year 2008, participation in the SNAP hit a new high of 28.2 million people, following a significant decline in participation through the late 1990s. Participation continued to hit new record highs every year until 2013. In 2008, the Farm Bill was enacted, and the new law increased the commitment to federal food assistance programs by more than $10 billion over the next 10 years. In efforts to fight stigma, the law changed the name of the federal program to the Supplemental Nutrition Assistance Program, or also known as SNAP. States maintained flexibility to name the program on their own, but were encouraged to change the name to SNAP or other alternate name. In fact, more than 10 states had already changed the name of their programs by this time. Other important changes included extended simplified reporting to all households, extended transitional benefits to those leaving a state-funded cash assistance program, allowed the use of E&T funds for job retention services, clarified that E&T volunteers are not subject to participation limit, offered states the option of implementing a telephonic signature process. The American Recovery and Reinvestment Act of 2009, also known as ARRA, was passed in response to the Great Recession, which began in December of 2007, to stimulate the economy and facilitate economic recovery. Among the provisions in ARRA was the authority to increase SNAP benefit levels. Since SNAP households spend nearly 97% of their benefits in the first month, the increased benefits were viewed in providing an immediate economic stimulus to the economy. SNAP households received the increased benefits between April 1st, 2009 and October 31st of 2013. The Healthy, Hunger-Free Kids Act of 2010, which reauthorized the school nutrition programs, was signed into law on December 13th of 2010, and implications for SNAP nutrition education. It restructured SNAP and the Nutrition Education and Obesity Prevention Grant Program, changing its financial structure to that of 100% federal grant funding to states with no state contribution or match. The act also reshaped SNAP by including an emphasis on programming and being centered on obesity prevention in addition to nutrition education and the promotion of physical activity. Moreover, activities to be evidence-based and delivered through individual and group-based strategies, comprehensive multi-level interventions, and/or community and public health approaches. Many SNAP efforts increase their focus on policy, systems, and environmental change, with a stronger emphasis on partnerships. By 2013, participation had rose to a whopping 47.6 million people receiving benefits. Then in 2014, the Agricultural Act was signed into law by President Obama, and though it was a combined two sections, it has made important changes to SNAP. Among the retailer-related provisions, it required FNS to update the stocking standards used to authorize SNAP retailers and provide additional resources to fight retailer fraud. It also called for pilot testing to use of mobile devices to redeem SNAP benefits and a pilot test accepting SNAP benefits through online transactions. In 2014, the Farm Bill also made important changes to SNAP certification policy. These changes include requiring that households receive at least $20 in LEHI funds to qualify for the standard utility allowance. The law also disqualified households where a member receives substantial lottery or gambling winnings from participating in SNAP until they meet normal income and resource standards. Quality control provisions have also been set to ensure minimal error thresholds, as well as states must submit an annual report to the USDA, and the creation of data exchange systems to lessen fraud. Florida's Food Assistance Program continues to focus on working with able-bodied individuals, focusing on employment and training, which lead to becoming gainfully employed. This concludes our session of the SNAP E&T History Presentation e-course. We hope that you found added knowledge about the program and services. If you have any further questions, please feel free to let us know. This presentation was brought to you by Cheryl Goebel. Thank you and enjoy your day.